Hello and thank you for coming today. With my 10 years background of compounding sterile and non-sterile medication, I wanted to go over the proper garbing and hand washing technique that you would need to enter into a sterile environment. A little bit about my background is I've worked for home infusion, compounding chemotherapy drugs, TPN for nutritional supplements, and antibiotics for infusion. I worked in hospice where we do pain management pumps, and then non-sterile suppositories and gels for patients. All these places have in common, we follow the 797/780 guidelines that you would need to compound in sterile and non-sterile environments. With COVID-19 happening, I know it's a scary place to live, so I just thought I would touch base on what some of the healthcare workers are doing. First things first is you would need to know the layout of a sterile room. So we have what is known as a ante/buffer room, and this is where you will do all your garbing and washing of hands prior to entering into a sterile environment. With that, when you go in, you usually have an open-faced hood, and you do all your compounding within 6 inches of the walls. So within your room, you have to count in 6 inches from all sides, and you have a smaller area to work in. That's your optimal safety spot. All the airflow and everything that goes into that is for another time. There's also segregated compounding areas, so you don't have actual walls separating your ante room from your sterile room. You have lines, but those rooms have closed box glove hoods. So it's completely closed, and you insert your hands into gloves and then compound within the safety area. All of these guidelines are found on the USP 797/780 website. And according to City Lab, people are particle generators, and we shed over 1 million skin cells an hour, and those contain microorganisms. And that is why we have to take such precaution when garbing and hand washing prior to entering into a sterile environment. And in reference from the Pharmaceutical and Compounding Lab from UNC, hand hygiene is the most effective method of preventing transmission of pathogens that cause infection and is essential for good compounding. Now we're going to go into garbing, and this is all from the general chapter of pharmaceutical compounding. Garbing will happen in the buffer and ante room, and you will start from dirtiest to cleanest, so meaning going from bottom to top. So first you're going to put on your shoe covers, and I have those here. And so these shoe covers, there's about 100 different styles that you can have in any of your garbing areas, but they'll open up, and you'll step your feet into each of these. And then after that, you're going to go ahead and put on your hair cover. I got what I could, but I wanted to leave a lot of the things for the actual workers, so I wasn't taking up some of their stuff. So you'll put on a hair bonnet, and then for men with beards, there's beard covers they can put on. And then once you've done that, you can then put on your mask. Once you have all of that placed on you, you can then go on to wash your hands. And for this, you're always going to want to use the hottest amount of water that you can stand without scalding your skin. That's very important. And using an antimicrobial soap, you're going to wash for at least 30 seconds. So just remember, sing happy birthday to yourself 2 times while washing your hands. You'll wash up to your elbows, and you'll go underneath your nails and around your cuticles. Now, people who will be going into compounding, there are special packets they get with tools to help them get all of that done. Once you've washed your hands, you will then don your gown. I left those for the medical professionals today. Don a gown, or a bunny suit is what it's known, and it's basically like a jumper suit. You'll place that on, and then you'll sanitize your hands with a special antimicrobial soap, hand sanitizer that has persistent activity in it. And that means it's going to keep working for up to 6 hours after you've put that on your hands. There's special agents in there that keep working to keep cleaning. And then you'll put on your first pair of sterile gloves. and then you'll take some 70% isopropyl alcohol and spray that on your gloves. And then you're ready to enter into a sterile environment. You might be thinking, why do we need to go through all of this? Well, some people need sterile medication prepared for them. They might have a serious infection that oral medication cannot combat with. They might have a gastrological issue, which is what they would need TPN for, which TPN stands for Total Parental Nutrition. And from Fairfax in the Medical Dictionary, TPN is a nutritional supplement that bypasses the digestive system, and it's dripping nutrient solution directly into the vein. So some people are either born with this, that they would need that, or maybe they had a botched surgery and something happened, and now when they eat normal food, their body won't process the nutrients that, you know, maybe you or I can get from the food we're actually eating. In reference to sterile versus non-sterile compounding processes in pharmacy, sterile compounding involves creating a medication in an environment free from viruses, bacteria, or any other potentially infectious microorganisms. Using these sterile processes are the best practice. Following the guidelines, we're doing this all for the patient's safety. And I hope you learned a little bit more about garbing and maybe why people might need sterile medication compounded for them. Thank you for your time, and I hope you have a good rest of your day. Thank you.